today, thanks for the opportunity. Today, I'd like to share with you some of my personal journey for this entrepreneur situation. And as I understand from Donna, that all of you work in Hong Kong as you know, inside the team, right? And do you guys trying to form a company and become an entrepreneur? Someday, is that the plan here, right? Okay, then I guess my story here, I think something to be careful about is I'm sure you're going to hear a lot of people smarter than me or similar like my situation to share the experience. Understand that when you are successful, they have all kind of things they can say about their journey, and they are so proud about that. But every people's story is different. So you build your own story, right? But I'm just sharing mine, and that's my disclaimer. So about Phase, I found Phase in 2015, and based on my core technology that I developed at UCLA. And right after this slide, I'm gonna talk to you all about the technology I have, because I know you guys are all nerds here. But I think just give you the latest that what happened to this company is that we are generating tens of millions US dollars of revenue every single month right now, because our rapid diagnostics for COVID tests now is the first FDA-approved test from Greater China, and right now we are dominating the US market, and people like Google, right? Every single employees are using our tests every single day, and we are supplying to, we are part of the suppliers to over 140,000 employees in the United States every single day. And as you will learn that the technology or the product that I have is just a pregnancy test, right? There's no patent on it. It was age-old. But the reason why we're able to do that, I would like to share with you, right? You know, when I founded the company in 2015, it starts because I got fundings from the U.S. government as well as Gates Foundation, and we're working on rapid infectious disease diagnostic, which is exactly what COVID is about, right? But at the same time, in 2018, I moved the headquarters to Hong Kong, actually pivoting my core technology into liquid biopsy because of one discussion I have with Professor Dennis Low, right? And I don't think I have a lot of time. I may share that at the very end about our progress on liquid biopsy, which is really our core mission here. The COVID has been a major distraction to us, but also, you know, allow us to make some good revenue to further support our course. But I think during the COVID situation, we are very lucky to get the grants simultaneously from three governments, right? The US government, Hong Kong government, as well as the Chinese government, developing different types of COVID diagnostics. But this is where I start. This is, well, I'm born and raised in Hong Kong, but I went to United States for college in year 2000. And when I graduate, the first job I have is as a project manager in a very small company that do something like this. Do you guys know what this is? It's a urine test, right? It's a urine test. When you interview for Walmart or any Amazon or any big company, well, back then there's no Amazon, but then the first thing they do is not to interview with some guy, right? They give you this cup, and then you go to the bathroom, you pee in the cup. They want to make sure that you don't smoke marijuana or do anything weird before they even want to talk to you, right? So this is basically my first job. This company is the manufacturer of these kind of products, right? Even back then, there was off patent, there was no innovation on this, right? And the sales of that company is doing pretty good, but me as just a you know, recently graduate bachelor student, and I went to join this company. I don't know what to expect, but then, you know, I hear from what the sales are telling us is that this is original what this my company that I work for have, right? So basically, this is what you call the lateral flow immunoassay, exactly the same technology as a pregnancy test, right? Very, very simple. You can produce each of these like couple pennies, right? US dollar pennies, right? But still, it's very cheap. And what they do is they have this cup, right? And then they just insert the strips on the side, on the wall. So this part could touch the urine, right? So when you pee in the cup, then the lateral flow action would just, you know, the capillary action, it would just wake up the strips, and then all the reactions happens on the membrane here, right? Then you read the lines, right? If you got 2 lines, you're fine because it's negative. If you got 1 line, then you're in trouble, right? That is essentially what happened. But there are flaws in this product, right? What happened to this product is that whenever you pee in here, the urine immediately touch the chemistry on the paper strips, okay? Meaning the reaction start immediately. Okay? However, this kind of test is time sensitive. You can't read this test after 30 minutes or an hour. Like everything would kind of messed up here because this is such a simple test, right? When things got wet, everything got messy. So, and at the same time, if the result is positive, and you know US people like to sue, you know, why are you claiming me that I took marijuana? I don't think I took marijuana, I'm gonna sue you. When you take this evidence to court, what happened? All the chemistry here is contaminating your sample. So the court say, hey, this is not a valid evidence, right? So then this is the feedback from our sales, and my boss told me that, hey, Ricky, come up with something new, right? So this is what I come up with, right? Nothing breakthrough here. It's just a very simple design change that I put the strip on the lid. It simultaneously solved the both problems that I mentioned, right? You pee in a cup like this, you put on the lid, okay? The back of this is actually a couple holes, right? Even if you tilt it accidentally, it doesn't start the test, but you start the test as you wish, okay? And at the same time, everything is being contained in this little chamber on the top. So I have some pressure and some valve here so that, you know, even when you pull, only a finite urine goes to the chamber and nothing else, and they don't come out, right? And this allowed, you know, the company doing a lot better, right? And you know, my boss was happy. But then there are still some problem with this, right? I mean, if you do smoke marijuana, right, and if you don't want to get caught, all right, unless you are in a prison, right, which we sell it to prison. We actually sell it to Saudi Arabia prison. You pee in front of whoever that one you get tested. You go to a bathroom and do that. So then what? You got tons of way to cheat, right? So, you know, you can add some bleach to that, you can add some salt, you can add whatever, right? You can change the pH, or simply use someone else's urine, right? There are tons of ways to defeat the test. Then the idea then I have is, what if you use saliva, right? When you smoke, your mouth got all this metabolite in the mouth, so actually it doesn't really affect the accuracy of the test. And so in 2 years, this is what we came up with, you know, which is becoming the first saliva-based drug abuse test in the US, in the world. And at the same time, this is till today the only FDA-approved saliva product for rapid tests. And this product did so well that the company that I work for, that I have no shares, right, got acquired by Alere, right? Alere later got, you know, acquired by Abbott, right? And now Abbott is kind of our biggest competitor in our COVID test arena. Okay. But you know, but this journey allowed me to kind of fall in love in rapid diagnostic because this is so simple and elegant. It's so cheap, right? Anyone can use it anytime they want, without any equipment, without any power, okay? But why is that only stick on in the scenario of a pregnancy test or, you know, for abuse drug? Why can't it be used to detect infectious disease like COVID or other applications, right? Can you guys think of the reason why? Well, it's a simple test, right? And when you want to detect, let's say, you know, some contaminant in your food, what are the concentrations of those contaminants? Very little, right? And the antigen in your COVID, yeah, if your viral load is high, you probably can detect it very easily, but still, right? In many applications, in healthcare situation, the problem of this test is it's not accurate enough. Everybody keeps saying that. I'm sure you heard about it these days, right? It's not accurate enough, and the reason really is because that the concentration of the biomarkers that you want to detect are usually very low. That's why you send it to lab, right? But what if you can find a way to improve this? Then maybe everywhere else, everyone can use this. A lot of time, I kind of, you know, spoil you the ending because I kind of did that. But so what's next? So that's when I went to UCLA to get my PhD. The mission is to try to find ways to, you know, to improve this. So then first I try to identify the problem, right? The problem is that, and this analogy I use it all the time, right? Just think of a cup of water. When you have a cup of water, you add 5 grains of salt in it, okay? And you use your tongue to taste that, what happened? You don't feel any saltiness, right? And there are 2 problems here, right? One, again, your tongue is not sensitive enough, right? The other problem is the salt concentration in that water is just too low, right? Most people, what do? right? They add some chip to your tongue. They ask you to taste that water for a little bit longer. They put AI or some other fancy thing on it, trying to, improve the accuracy here. And I think this is something that, people on the ground level would just laugh about this, because you are missing the most important, a lot of parameters that dictate whether people would use their money to buy this test or not, is not only the accuracy, right? Well, you add a chip, you taste it longer, you sacrifice the inherent advantages of your tongue, which is simple and quick, right? Then my approach is not to change the tongue at all. I change that cup of water, right? What if, imagine that cup of water, I concentrate that into one droplet of water, still 5 grains of salt in that drop of water. You use your tongue to taste it, I'm sure you can feel the saltiness, right? And this is exactly the technology that I developed to do that. So, and this technology itself is also not super novel or groundbreaking in its own right, because this technology has been used in the industry for over 100 years, right? A simple, very emotion technique that what they call the aqueous two-phase system, okay? Just like oil water, right? That it exists in two phases. Why? Because they are immiscible to each other, right? Aqueous two-phase system is a little bit different because both phases are aqueous, right? That's why it's friendly to the biomolecules, right? Not unlike organic solvent, would just denature everything, right? But how does that actually work? There are a lot of ways that can produce an aqueous two-phase system, right? One of them is something called a polymer salt system, right? So if you look at this polymer PEG, I'm sure everybody knows PEG, right? So PEG, what happened is you see this, they have this oxygen group in here, right? Which make it likes water, right? So if you put PEG in water, what happened? Right? If you put PEG in water, this is your PEG molecule, right? It's a polymer. Then basically water naturally just come around it. You form a water cage. Okay, you form a water cage. And then basically this bounces off another PEG molecule, right? They don't really want to get together too closely. Okay? So what happens if you start adding some salt to that solution of polymer soup, right? What happens is, if I'm a water molecules, I would very much like to associate with the ions rather than the polymer, because the interaction is stronger, right? Then what happened? Then all the waters are associating with the salt and are not with the polymer. The water cage broke. And then when you can imagine in your water, everything polymer just waving around having a party, right? So now when the water cage are gone, now you can get a lot closer to each other, right? So what happened when two molecules get a lot closer to each other? Something called van der Waals interaction happens, right? They become attractive to each other, okay? So what that means is, microscopically, you're forming domains that are polymer rich, and then you have domains that are salt and water, okay? And the polymer just getting more and more hydrophobic, because when they get close to each other, this oxygen group is kind of gets shielded, right? All the part that they want to associate with water are kind of shielded. So the polymer become more and more hydrophobic, and then of course you have salt water, which is by definition, very hydrophilic. So basically you form this kind of droplets, right? You form these domains of salts and polymers, right? And then it's a Brownian motion, right? You kind of mix in together, and then they kind of coalesce to each other, right? Like just imagine oil and water, right? You shake it up, it becomes cloudy. Why is that cloudy? Because you break it up into billions of little oil droplet and water droplet. They just still don't like each other, right? So even when you shake it up, you break it open, but then they still exist, something like that. But what happens when you let it sit on the table, right? A couple seconds later, because the energy maintaining that droplet stage is very high, right? They like to merge together to reduce the surface energy, right? And that's why at the end you get two large bubbles, two large droplets, right? Which is the phase or the layers, right? Then you got, some layer on top, which is purely contained of the polymer, and then salt has a higher density. That's why they stay at the bottom. Okay. So, that's why I went to the bioengineering program, right? Everything is a lot of physics, a lot of chemistry in that. It's just all math, right? When I joined this professor, he have great models coming out of MIT, and I learned all that, right? Very painful math and all that. There was no application, okay? But I come in with some ground, level, understanding of the industry, and that's why me and my professor come together, and it become very exciting. But is that when you have some biomarkers, right? And each of the biomarkers, they have their unique signature. Sometimes they are more hydrophobic, sometimes they are bigger, sometimes they are smaller, sometimes they have an epitope that like to bind to something, right? Each of them may have a unique biological, physical, or chemical unique signature. Then you can really adjust the polymers and the salts, or there are a lot of other compositions that can form this two-phase system, right? But then you can specify on the target that you really want to concentrate or you want them to associate with, and then you come up with your formula, okay? And then naturally, you can get them all partitioned, meaning distribute into the one phase versus the others, okay? And this can be very powerful. If you look at the partition coefficient, right, which is the concentration on top over the bottom, you can get something on the hundreds, right? Actually, in theory, it can go into the millions, right? But there are some other reasons that I'm not going to go over here. But at least imagine you got 500 molecules on the top phase, only one molecule on the bottom phase. That's pretty good, right? And the thing is, when you think of oil water, you're all imagining something like this, right? You kind of have this split in half, right? But it doesn't need to be the case, right? Remember the 1 cup of water and 1 droplet case that I mentioned to you? What if you change the volume ratio? You can tune the biomarker, you can tune the polymers and the salt concentration theirs, and you can completely dictate the volume ratio in here, right? So imagine everything like to go to the top phase and you have a volume ratio of 1 to 9 in here. Then you're essentially concentrating this guy by 10x, right? Because now this molecule would only ram in a volume that is 1/10 of its original volume, right? So this is the time that, great, you know, my lab was very poor, and we don't have a lot of budget, and I simply just called the vendor that I work with during my job and say, hey, I'm working on something interesting here. Can you send me some free sample? And they, okay, fine. Then because you know the sales do that anyway, right? I get all the sample. I build all this tests in my lab at UCLA, and then I built this. I built this myself at UCLA, and then I just basically build a system that can concentrate the target that I want to detect, and then when it happens, then I transfer this to here and see what happened. Voila, right? Good publication, right? In 1 year, I published 3 papers. Basically, I'm just demonstrating this exactly same methodology in concentrating bacteria, and then other papers talking about protein, and then other papers. You guys are academia, you know how that works, right? So that was pretty good. But then as an academia, as my professor that is really want to stay in academia, I don't feel the same way. First is because I look at him that he works so hard, but then it's tough. It's a tough world in academia, right? And at the same time, because I have some industry experience, that I feel like if I really want to help people, I don't want to just publish paper. I really want to make this happen, right? And this thing is simple enough. I built this all by myself, right, in a couple months, and then it proved it seems to be a great idea, right? So what if I just do this myself? And that is the time that I'm thinking about entrepreneurship, and then I go to places like this class, right? I join the MBA program. Like, I don't join the MBA program, I go to the classes that were taught by the MBA program, and then there are professors and instructors like you guys that kind of talk about all this, and then I learn. I kind of know what was things going on. And then I do something that now is so popular in Hong Kong, a competition, right? So I do this in Suzhou, right? That was 2012. And then I go, I make this, 宣打检测比, right? In Suzhou, I don't even know how to say Mandarin properly at that time. And then the idea is, I have this, food sample. The idea is trying to detect, what's that in English? Triamine, 三聚氰胺, right? In milk powder, right? Back then it was kind of a big thing, right? And they say, hey, you have this milk powder, and then you use this pen to suck up the milk up there, and then you simply press this button, which introduces the test strip to the concentrated top phase, which are all the 三聚氰胺 being concentrated on top, right? And then you can read the result, right? And that was the idea. And then, well, back then, even in China, these competitions are kind of, whatever, and I'm able to get to the final round, right? And then the judge, which are some high official in Suzhou, and then he asking me 2 questions, which I failed miserably, right? The first question is, Ricky, have you graduated yet? I said no. I mean, you understand this competition with the idea of if you win, then they give you some money, they want you to stay in Suzhou and start your company there. I'm not even graduate, So I'm not showing my sincerity that I would like to stay in Suzhou, right? The second question he asked me, how long would this take? Okay. So you've been thinking when I introduced to you, I hide some very critical facts about this technology, right? So I'm telling you, think oil and water. But this is not oil and water. When you think of oil and water, you shake it up, you let it sit on the table within seconds, right? You can't get this separation out. So that seems like this is amazing, right? You shake it up, you put something, you shake it up, and then you wait a couple seconds, and then you got something concentrated without any equipment, without any power, without any training, right? And then you introduce to your diagnostic to make it better, right? That's not the case at all, right? When you think of aqueous two-phase system, because they are aqueous. They are still within the same, domain that they don't like each other, but they don't hate each other that much. So what happened is that it actually takes hours for this to complete, right? It was stupid of me, but then back then I don't know anything better, right? Hey, I can get this 8 hour, I get everything concentrated to the top, awesome, and then I can apply it to a very simple test strip, right? Hey, the test strip itself is 20 minutes, but I need to wait 8 hours for this to happen. Of course I failed that competition. That doesn't make sense at all in hindsight. So back to school. I mean, I haven't graduated yet, so I'm just keeping thinking about the second half of my PhD, right? And then in one night that was completely random, I come up with something amazing, okay? And this is completely by accident. That I found that instead of letting it sit table and let it separate by itself, what if I dunk that homogeneous phase, the milky state, I just put in some specific types of paper, okay? These specific types of paper, when things wake up, they introduce an additional interactions to the droplets, okay, which is directly in the flow because of capillary action. That, for some reason, and honestly, I can tell you to this date, I still don't know exactly how this happened, okay? But I'm not academia, which I don't care. And I'm able to accelerate this and able to get this done within minutes. And later on, when I fine-tune more paper and different structures, I get this done within seconds, okay? Then I'm really able to fulfill something that I think was a great idea, right? Which is able to concentrate something with something very low cost, right? With just some paper material. And I think what, the pregnancy test that I know of is also a paper-based diagnostic, right? So naturally, all you need to do is put this concentration module that I call, this concentration module, right? And then on the upstream of my test strip, right? And then I can able to get 10 to 100 times better concentration of the samples and better detection, okay? So this is the stop where I get my PhD, right? And then I was keep trying to write grants to the government, and by the time when I graduate, I got my first grant that allowed me to leave my professor lab and actually do something. So now, further accelerate to the time that I come to Hong Kong. I don't know if I have a lot of time, but then how much time do you have? Around 15 minutes? Okay, I'll go fast. When you go to Hong Kong, the idea is to apply the technologies into liquid biopsy. And the reason is because, and that is inspired by Professor Dennis Lowe, is that, because initially I was stupid, right? I think that, hey, PCR can amplify your DNA millions or billions of times. Why do you need to concentrate something 10 to 100-fold, right? Dennis Lowe told me that, hey, in early cancer or when the fetus is young, you just simply don't have that much biomarkers in the sample, period, right? If you can really extract them and get them now, that would be a billion-dollar business, okay? And after that discussion, I immediately called my team in US because I was in CUHK, and then I said, hey, let's try this out. It works to some degree, and that's why I decided to really set up the lab here in Hong Kong and really focusing on the technologies. And assuming 12 months later, then we are working with MD Anderson, the largest oncology center in the world, to validate our technologies. I'm sure you all use QIAGEN extraction kit, right, for DNA. We have a head-to-head comparison on cancer patient samples, and we show that we are many times better than QIAGEN in extracting DNAs, our genetic material, using our technology. But then this is what happened in last year, early last year. In February, we were all focusing on the cancer diagnostic. In fact, we have a kit that the one that I just mentioned, that is way better than QIAGEN. We have this all packed, commercially. We're trying to launch that. That is February 2020. A professor from Beijing called me, say that, hey, Ricky, COVID is happening, and then the PCR that we understand of is not that accurate. Is there something your sample preparation can do, right? And that was the time that right after Chinese New Year, everybody stay home. Government said work from home, and then I say nobody works from home because we work in the lab. But let's try to do something interesting. Let's try to do COVID, right? So in 3 weeks, our whole team in Hong Kong and in California working around the clock. In Hong Kong, we worked 15 hours, right? It starts from 9 o'clock all the way to midnight. I send my colleagues back in taxi. I didn't sleep. I get all the data. I send it back to California. Then my team keep working on it. So basically, in 3 weeks, we're able to work around the clock globally, right, for 24/7. And in 3 weeks, we got our first kit, which is what this guy is holding. This is not me, by the way. But what is this? It's an RNA extraction kit that in our own lab, we demonstrate that we are 10 to 50 times better than QIAGEN in extracting RNA, okay? And then I called this Beijing professor back. Well, before that, I called Professor Yun. I said, hey, can you give me some sample to try? And it's like, are you kidding me? There's less than 100 cases in Hong Kong, right? I can't spare you any sample. I said, fine. Then I called this Beijing professor who works in Kezibu, right? And then he gave me a special permit to enter Wuhan, right? And then we have able to do our head-to-head clinical comparison with the national gold standard. So what happened is that they enroll 20 patients that goes to the hospital. They don't know if they got COVID yet, right? And then they split the sample in half gone through the national gold standard, and then the half go through our extraction kit, and using the same PCR assay downstream. And they found that the national gold standard, they found 5 confirmed cases, right? And then use ours, they found 7, right? And the extra 2 are confirmed to be real COVID cases as well. And this demonstrates that, by extracting extra RNA, we are able to increase the accuracy of the downstream PCR. And that's great. And then later on, the Chinese government give me some money, but because all the extraction step is all manual, so then I write a grant to the Hong Kong government asking for budget to work on this automation procedure, and then I also got that, right? And then, I was so excited because I'm really able to contribute, and then I do this locally, and the government even give me some money. So when everything is ready in June and July, right, I tell the Hong Kong government, hey, I got something working now. Can you start using this, right? The answer is no. As usual, right? But can you think of why? Right? The reason is because, which in a way I really understand, and is that they all using Roche and Abbott, instrument. If you know what happened in X-ray, they use Cepheid, which is a very good assay, but then, it's very expensive. But they have their all mature protocol and SOP and reagent and, all this. So they can't simply use, a no-body assay that, yeah, you got 20 sample proved to be okay, right? Why would I switch over to use you? But at the same time, as you guys remember, Professor Yun has been complaining to the government every single day on the media that we can only do 2,000 tests per day. How can we handle the third wave or the second wave back then? I forgot. And then the government gave me an advice, right? Which to most people is very unreasonable. Say, hey, Ricky, you got all this, you get all this kit out. Oh, by the way, in June, I have more than just the RNA extraction. I have the sample collection kit, right, which we invent that can preserve the RNA up to 40 degrees for a whole month. Okay, we invent that. We also work with Professor Liu Pun and Professor Yun Guoyong. We combine the PCR design into a multiplex PCR assay. So basically, we have the entire, products for PCR. And the government gave me an advice. Hey, Ricky, all this product, we can't really use it. Why don't you build your lab? And then we can purchase your service. Okay, I say most people when they listen to that, they call this bullshit, right? Like, how can I do that? I have been a researcher. I really have been thinking about building products for someone to use. This is be a service provider. Just like you have been growing cows and making patties, they now need to start a McDonald's, right? This is a completely different skill set. Okay, but to me, I spent all this manpowers and all this resource to do this. And in fact, actually, I'm selling this globally already. This kit, this RNA extraction kit, is the only Asian company that is on FDA recommended list for RNA extraction, okay? So I'm doing okay, but at the same time, I really want to help Hong Kong because that's what Professor Yun Gaoyong complains every single day. So I do something bold, right? I work with my local lab that has no intention of doing COVID at all, but they have the accreditation, which allow them to legally do something about that. We built the entire lab from scratch in Kwun Tong, right? In 1 month, we built this entire lab all by ourselves. And then this lab is different than all the major players, which you know, the BGI, all this Chinese lab that have, you know, at least 10, 20 years of experience of doing that. Every reagent are made by ourselves and developed ourselves in Hong Kong. And then there was the time, you guys know what the CTC, Community Testing Center? Yeah, of course you know, right? But then, back then there were only 4, okay? And there were 4 industry players, not us, right? There are only 4. So the government understand who can really do this. That's why they only offer 4 CTCs back then. And I'm like, hey, you say you don't want to use my test, and then you want me to build a lab. I build a lab, you couldn't give me the opportunity to do the CTC, right? And then I also do something crazy, right? They give the tenders papers, right? I guess that's okay to disclose this, but all this, and I don't even get it, right? They say, hey, Ricky, yeah, you just get qualified, but then as of today, you are not qualified yet because, you know, we are doing some paperwork, right? Who knows how long the paperwork takes? I don't care. Give me that thing. I mean, you know, I'm a Hong Kong citizen. I can ask for this. This is nothing confidential. Okay, they emailed that to me. In that email, they still have that big disclaimer said, hey, you are not qualified to apply for this. I don't care. I put a price so low that they can refuse. Okay? I'm not going to tell you what that price is, but right after that email, right after that application, the government in 1 week find me a 5th center, okay? And that's in Lai King. And on the first day, you know, our chief executive is so surprised that someone other than the big 4 is able to host a CTC, and that's why she and Professor Sophia Chan come to visit, and this is my perfect opportunity. Okay, so what happened? Instead of just be a nice guy and show her around, right? I asked Carrie Lam, can I talk to you for 15 minutes? Okay, she said yes. And then in this community hall, we find this room in the backstage, and then we talk for an hour and a half. So what exactly happened in that room is that I'm proposing to her another product that we have been developing, which is the rapid diagnostic, the COVID rapid diagnostic, right? Everybody, even till today, in Hong Kong, mostly, they're thinking about the gold standard being the PCR. But as some guy that start with the journey on rapid diagnostic, I fully understand the benefit of rapid diagnostic is that you got result in 20 minutes. Okay? It's so cheap that anyone can use anytime. Okay? And for PCR back then, even when you got positive, it takes all this paperwork and workflow. You isolate the guy probably 4 days, 5 days afterwards. Okay, I tell her that, hey, what if we do something called a dual track program? Okay, when people come to CTC, we do the swab. Because of the special chemistry that I also invented, that it preserves not only the RNA, but it can also preserve the protein biomarkers of COVID. Meaning that when you do this one swab, I can do the test, the rapid test immediately on site. The remaining solution, I can send it to the lab to run PCR. Okay? So there's zero disruption to the citizen. At the same time, you give me the opportunity to tell you a preliminary result is preliminary, it's not confirmed, right? But I can tell you that in 20 minutes. And you can confirm all you want by the PCR, right? And she said, yes, let's give you a chance to try, right? So now in December 10th, Laizing Fayuan, right, there was this outbreak. And we are the first one to do this mobile, collection site, which now become a gold standard. And we set up everything at 1 o'clock. We start the people coming in. Back then, there's still a lot of reporters because it's something novel. And in 2 hours, we found the first and only positive cases in Laizing Fayuan remaining that are not in quarantine. And by 4:30, Zheng Zhuguan Yisang already announced that to the media. So that whole thing is done on the same day, okay? And later on, that's why they are encouraged then, in the upcoming December and January, We have done this for over 20,000 citizens in Hong Kong using this approach. And that's allow us to own the world's largest clinical set of data on our product, well, on any rapid COVID product compared to a gold standard PCR. And I believe this is one of the major reasons that ultimately earned us the first FDA EUA in Greater China. All right. Oh, this is the first ever super fast mobile site that Professor Yuan Guoyong called me at 5 p.m. Say, Ricky, this is Wang Daixin, okay, Guidong Lau. And can you set up something here so that I want to ensure that someone, on the 19th floor and below can be tested immediately by your rapid test so I can determine whether they need to go quarantine or not, right? So he only gave me 3 hours. So I went there, I asked all the police and all the guys to ask what kind of material you have, ping pong table and all this, little cloths. And then we set up 3 stations here, and then we escort the citizen here. And then, by midnight, I called Professor Yun that, hey, there is no confirmed case, at least by rapid test, okay? And then, in a few hours, the PCR also come back negative. Then, the decision can be made. So this is the rapid response. But in just 2 months, this is what happened, okay? Now we all got this nice thing and, get all this a lot more professional cases. Okay, I understand my time is short, so I'm gonna skip to the end. You get the general idea. But I think this is the most interesting slide that I would really like to share you. This is really comparing my time in academia and my time working in the industry that you guys may face. Back then when you were in the lab trying to write a paper, honestly, there are a couple of things that you want to worry about. First is proof of concept. You just make sure your things work, and then you need to understand what that's going to explain to others. You want other people able to reproduce that. So you want to have some in-depth knowledge about what actually does happen in your results, right? But then, depends on your field. Sometimes all you need to do is anchor to 3, and you can get a publication now. Of course, we aim for a high-impact journal. You probably need to do more, but this is the minimum, right? But there's nothing compared when you are in the industry. There are a lot more things to consider, right? A, your performance, you can't only just stay on proof of concept. It has to be clinical relevant, right? Because people would actually rely on that to make life and death decisions. Scientific understanding, sorry, like that paper thing, I still don't fully understand what exactly happens, maybe someday, right? But then, not a priority, as long as it works. Reproducibility, right now, as I mentioned, I'm producing 10 million test kits every single month, okay? Each one of them better work. Cost, right? This is actually how much it has to be. You guys buy my test at Watson's, yeah? Let me tell you that 45% of that is not to my pocket at all, right? Watson takes that. This is. We have to ensure that our cost of goods is something like that in order to make some money. Ease of use is crucial, right? Especially when we are developing a population base, and we want anyone to use it anytime they want, right? With minimal training, right? Regulatory, we are super lucky. Well, I shouldn't say that, but because of COVID, this kind of got waived, right? But if not, then it will still be a long way for us to get things get approved, right? But that's exactly the reason why I moved away from infectious disease detection when I first got all the US grants and moved to liquid biopsy, right? But I want to skip here. You guys can read this later, but there are so many questions that you really want to ask. And this tells you that entrepreneurship, when you're trying to do commercialization, there are a lot more things that you will consider, but this makes it so much more fun, honestly, okay? Yeah, the last part. You may see me end up in jail if I'm not careful. Right. Okay, last slide, I promise. So reflecting, as I mentioned in the very beginning, everybody would try to tell you they reflect on it and what they think is something that could be successful. Again, don't trust me entirely because every success story is different, right? But let me tell you what I think. Okay. So obviously, nothing special here, right? You have the core technology, you have capital, you have talent, you have the relationship. But how do I rank them? So what do you guys think is the most important? Right? Most people would think core tech is important. I mean, you guys are supposed to be a biotech company, right? Like, if you don't have tech, then what are you? Just make boba tea, right? Which is absolutely true, okay? But I think this is kind of given. Everyone here is a brilliant scientist, I'm sure. I'm sure you guys all got some nice tech, right, to offer. So this is kind of given, right? That's why I'm telling you the priority of this is actually not high. Like, they don't put all your weight in thinking about your technology, because at the end of the day, or the customers or the government, they don't care. Do they care my packed molecule, how do they behave? No one cares about that, right? You should really think about that. But what is important, okay? So I think the next part is relationship. Many people ignore that, especially academia, right? But then the relationship dictates how high, how far your enterprise or your business can go, right? I capture the chance when the chief executive come visit me. I have an hour to pitch to her the biggest pitch I can ever make in my life, in my career thus far, right? And then I build a relationship. When I start, I have no relationship at all, right? So this is something, like everything here you can cultivate, meaning, you don't need to be Li Ka-shing or anybody in order to be successful here. But you need to recognize that these are the key elements in order for you to be successful. And then the next part is capital. Without money, you're done, right? And even if I'm making $100 million per month, if I burn $100 million per month, then I have nothing, right? So don't feel so proud that you wave a couple $millions and then you feel happy about that. If you burn also a couple $1 million in a year, then you are dead. I mean, you're bankrupt in 1 year, which is exactly what I had happen, right, before. I want to emphasize on this. If time's allow, I'm gonna spend a few more minutes on this. Talent is the most important part of all enterprise. That's why sophisticated US investors, okay, I'm saying US because they have the most sophisticated, and they have years of failure, success, and that's why they can really concentrate the experience down and tell you that the one most single thing they invest in something is not your technology, but the people, okay? So when I say talent, I can break it down into 3 categories, okay? Yourself as the founders, okay? Your team, okay, and also your mentor. I can say they are all very important, okay? Of course, if you want to be the leader, you want to be a single guy, then yourself is the most important part. Like whether you can work with a team, whether you can keep learning new stuff from a mentor, you are the most important part, okay? But this is the sole reason why we are being successful, so-called successful, because we have a group of people that really just trying to go crazy, right? When I say COVID, nobody complain, we just all work. Okay, when I say let's get on the street and do the community testing, all my R&D folks, even my accountant, go to 麗晶花園. Okay, later on it's not allowed, right? Well, they are not doing the swabbing, which is never allowed. Okay, but they were at least doing the logistics. They are helping people coming through and all that, right? So they're doing all that, and actually the accountant do the auditing of the data, which was never being a requirement. But we want to make sure nobody get a bad report. Of course, there are some other competitors. Got in trouble because of that. But talent part, someone also kind of ignore is the mentorship, because there are no right way of making a business work, but there are so much that always you have to learn and you can learn from others. So I think the biggest reflection I have is the fact that I always trying to learn something new. I always trying to learn something from everybody that around me, right? And kind of reflect on that, whether this is something that worth learning, or whether something this is a bad habit that I don't want to retain, right? To keep improving yourself and trying to keep when chance come and be prepared, right? So this is I have the honor to be the nominated as one of the 10 outstanding youth. But I think this is the part that I really want to tell the public, right? Most people in Hong Kong, we are all smart guys, and we always want to see the evidence where the trends are before we jump, right? We are so calculated. But in a situation like entrepreneurship, this mindset, I think it should be changed. You have to believe in something first. You can't calculate everything. Believe in yourself, believe in your team, believe in your technology, and just go ahead. Irrationally see if that happens, right? Thank you.